there's a growing physician gap in the US. There are not enough physicians to see an aging population, and that by over the next decade, it's going to be as many as 130 to 150,000 physician gap out of a million practicing physicians in the US. That's full 10%, right? That capacity has to go somewhere. At the same time, it's not just the physicians, it's also the pharmacies. Retail pharmacy closures, we've tracked over 10,000 retail pharmacy closures in the last 6 years. So that opens up these gaps in the ability to access care. And then for many patients to be able to get into the pharmacy to get a prescription filled, talk to the pharmacist, get educated on these pieces. And unfortunately, where a lot of those cracks sit are where society can least afford them to sit, right? It's in rural America and it's in the inner cities. So it creates a healthcare desert for accessing care for many Americans. It's very challenging. They are right. So when we think about, especially at the physician level, the amount that is shifting to nurse practitioners and mid-level practitioners is definitely increasing, and it's actually part of the talk is explaining this. Urgent care also is estimated to double in size between now and the end of the decade. I mean, for many of the people in the audience, they may not even have a primary care provider that they go to, right? When you get sick, you go to urgent care. And how does that alter the patient's journey as they're getting into the health system, right? If you're going to a PA or a nurse practitioner and they're working you up, is that the same as what a physician is? Their health? No, right? Those are real questions, right? As we think about what's it mean to manage in the healthcare over the next decade. For the retail pharmacies, they're hugely important to the health system. Just look over the last 6 months to see what's happened between Walgreens, right, where they've had pharmacists walk out because of working conditions. You've had Rite Aid file bankruptcy, right? I mean, their stock price 5 years ago was around $30. Last time I looked at it like a week ago was 7 cents. 7 cents, right? CVS off 30% from where they were pre-pandemic, right? Those are real pressures that sit on the healthcare system today. And that, we're not, as an industry, right? Pharma, payers, pharmacies, talking about some of those pressures, that has a direct impact on the ability to access and maintain access to care over the next decade. That's a big question for us.